I've had 2 procedures with Dr. Miller for basal arthritis disease on my left thumb and my right thumb. The limitations of basal arthritis make it almost impossible once it really progresses to open a can, turn a jar lid, lift. The pain is so excruciating as it develops, it makes it very difficult just to do day-to-day things that you would normally do for yourself or in your home. Very debilitating. Just a simple motion of using your hand with your thumb can really just send excruciating pain into your hands, your fingers. So it makes it very difficult just to function. Dr. Miller was recommended to me by several people that I came in contact with in my previous position with the Chamber of Commerce. So many highly recommended him. So I sought out Town Center and found Dr. Miller. I really didn't have a good understanding at the time of what was causing the pain. So I went right into setting myself up for an appointment. Dr. Miller was wonderful. The original appointment from the beginning, we talked about conservative treatment, doing some therapy. Then it progressed into having cortisone injections in both thumbs, again at different times. And then the option of course, going for surgery, depending on how long I could tolerate having the pain. You go in, you have your pre-op with the folks in the surgery center. Dr. Miller came in, talked to me, explained again the procedure, basically how long it would take, what my post-op time would be in the surgery center. And then I was on my way home with good instructions, medication if I needed it, and a post-op appointment which had already been set up for me. Post-op was within 1 week after surgery, and the recovery was probably overall together 3 to 6 months. But the first portion of the post-op involves getting a cast put on, which you wear for 3 additional weeks, and then going right to occupational therapy. Dr. Miller likes patients to go for OT so that you can start working on regaining the range of motion in your fingers, in particular your thumb, and regaining your strength. So I'd say the total post-op time for me was at least 6 months before I was able to really lift and utilize my hands fully with a range of motion. After occupational therapy, which for me was at least 6 weeks, 2 sessions a week, I was totally pain-free after and still am. I can do everything that I was totally limited to doing, such as turning, lifting, grasping. All of that has been alleviated by the surgery. I'm very happy with the results, very, very happy, and have told many people about the success of the surgery that I've had and recommended to many patients and people suffering with this that the procedure itself is fabulous and with wonderful results. I would recommend Dr. Miller, Town Center Orthopaedics, to anyone that has any type of condition such as the arthritis. I find Dr. Miller to be very, very compassionate. He's a wonderful surgeon, and really make sure that as a patient you understand the procedures you're going to have and what the outcomes will be, and the follow-up with him was wonderful.